Vitamin A plays a quiet but foundational role in maintaining the health and resilience of the respiratory system. It supports the integrity and function of the mucous membranes that line the lungs, bronchial tubes, and upper airways, tissues that are constantly exposed to the external environment and its many airborne challenges. Whether we're breathing in dry winter air, dust, pollutants, allergens, or pathogens like viruses and bacteria, these respiratory surfaces serve as the first line of defense. Vitamin A helps ensure that these defenses remain strong, responsive, and capable of clearing threats efficiently, making it a crucial nutrient for respiratory health across the lifespan. At the core of its function, vitamin A supports the production and maintenance of epithelial cells, which form the lining of the respiratory tract. These cells are not just passive barriers. They are dynamic, self-renewing surfaces that secrete mucus and host immune-active compounds. The mucus they produce is vital. It traps inhaled particles and microorganisms, preventing them from penetrating deeper into the lungs. But this mucus must be of the right consistency and constantly moved out of the airways by tiny hair-like structures called cilia. Vitamin A ensures that both mucus production and ciliary action function effectively. Without sufficient vitamin A, mucus becomes thick and stagnant, while the cilia may become damaged or less active, allowing pathogens to settle and proliferate. This protective mechanism is especially important in young children, the elderly, and those with weakened immune systems or chronic respiratory conditions like asthma or bronchitis. In these groups, even mild deficiencies in vitamin A can lead to more frequent respiratory infections, longer recovery times, and an increased risk of complications. Studies have shown that children with adequate vitamin A intake are less likely to suffer from repeated bouts of pneumonia, bronchitis, and other lower respiratory tract infections. In regions where vitamin A deficiency is common, simple supplementation programs have led to dramatic reductions in childhood mortality, largely by decreasing the incidence and severity of respiratory and gastrointestinal infections. Vitamin A's impact doesn't end with surface defense. It also plays a critical role in immune regulation within the respiratory system. It supports the activity of T cells and B cells, two types of white blood cells that help the body recognize, attack, and remember invaders. It also supports the function of macrophages, which patrol the lung tissue and engulf harmful microbes. This internal immune defense works in harmony with the outer barrier to provide a layered, intelligent response to infection. When vitamin A levels are adequate, this immune surveillance is both responsive and regulated, attacking pathogens without overreacting or causing unnecessary inflammation. Moreover, vitamin A is involved in the healing and repair of respiratory tissues following inflammation or injury. Respiratory infections and chronic exposure to irritants like smoke can damage the epithelial lining, leaving it vulnerable to further attack and scarring. Vitamin A accelerates the regeneration of damaged tissue, restoring the mucosal barrier and helping the airways recover more quickly. This is especially important in conditions like asthma or COPD, a chronic obstructive pulmonary disease, where inflammation and tissue damage are ongoing concerns. In environments where air quality is poor, whether due to pollution, industrial exposure, or cigarette smoke, vitamin A becomes even more essential. These conditions create oxidative stress in the lungs, damaging cells and weakening immune defenses. Beta-carotene, the plant-based precursor to vitamin A, also functions as an antioxidant, helping to neutralize free radicals and reduce oxidative damage in lung tissue. This dual role, supporting both the structure and the internal resilience of the respiratory system, makes vitamin A a uniquely important nutrient for individuals living in urban or high-pollution areas. Dietary sources of vitamin A that support respiratory health are both varied and accessible. Preformed vitamin A from animal sources like liver, eggs, and dairy provides immediate benefit, while beta-carotene from carrots, sweet potatoes, spinach, and red bell peppers allows the body to convert what it needs on demand. This flexibility in sourcing makes vitamin A a highly available nutrient for people following a wide range of dietary patterns, from omnivorous to plant-based. What matters most is regular, balanced intake over time. It is worth noting that the relationship between vitamin A and respiratory health is not simply about quantity, it's about quality and balance. While deficiency poses clear risks, Excessive intake of preformed vitamin A can also have unintended consequences, particularly in supplement form. However, consuming a diet rich in colorful fruits and vegetables, complemented by moderate amounts of animal-based foods or fortified products, provides a safe and effective path to meeting the body's needs. Vitamin A, in its quiet, restorative way, supports the rhythm of every breath we take. It maintains the soft linings of the airways, empowers the immune system to act decisively, and helps the lungs recover from the daily stress of our environment. For people of all ages and walks of life, ensuring a consistent supply of this essential nutrient means giving the body the tools it needs to breathe freely, resist infection, and recover quickly when illness does strike. It's a reminder that sometimes the most powerful protection we have is already within us, waiting to be nourished, supported, and sustained through the simple act of mindful eating.